Dear ladies and gentlemen, warm welcome to each one of you for this penultimate day of our volunteer training program. Today's topic is home-based palliative care. What's the need of home-based care? What are its components, services of home-based care, and types of home-based care? All these would be explained to us by Lieutenant Alice Stella Verginia K.J. She had a nursing training and services in Indian Army. Joined medical college in 2006, since 2007 in palliative care. National faculty, presented papers in international conferences of Indian Association of Palliative Care, and has conducted workshops. She has received International Excellence in Palliative Care Award and contributed to many chapters and scientific writings. Hearty welcome to you, Lieutenant Alice. Over to you, ma'am.
Thank you, ma'am, so much. And thank you, Rajalashmi, also. I'll just share my screen. Is it visible?
Yes, ma'am. Can you make
Yes,
it into presentation view?
It is in the presentation view only. Oh, wait. So, welcome to all my participants. So, I'm going to talk to you today about home-based care. I hope you all know what is home-based care. Any idea what is home-based care? Can any one of you just put it in your chat box if you know what is home-based care? Just one or two response, it will be nice. Just I want to know what you think about home-based care or what you know about home-based care. I hope all are attending. Yeah, one response has come. Let me have a look. Assistant support provided at home. But Charmi Pandya, can we do of a patient at home? Care of a patient at home. Good. Home-based care is provided at from Dr. Siddharth Sharma. Well, I hope I got it that some of you know about home-based care. So now let us see exactly what is home-based. Introduction, we say it's a home place of memories, familiarity, and safety. Wherever we go, east and west, north and south, once we are back home, home is the best because it's a familiar place for us. So many memories are there. And a place where we remain comfortable, relaxed, and confident. And of course, the blessed place for freedom of choice and autonomy. We can do anything in our house, right? But once we are out of home, if we go even to our what is the relatives also, it is also very important. Availability is also important. And the aim of the home care is to make treatment otherwise available at home when it is needed, especially for the people. Now you all know this one. Actually, the definition of palliative care to whom we. So it should be available at home, the treatment whenever it is needed. Why home care? Home care is very different from hospital care. And of course, the best place for caring chronically ill patient who needs a long-term care with the support of the family and in their home. Visiting a patient and a family in their own homely atmosphere, it is really different. See, when you go to a hospital, when you visit a patient, that visiting and visiting a patient in their own homely atmosphere, that is very different. And of course, to provide a quality patient care in the home and community setting. Who needs home care? See, in the definition, it is said all life-threatening illnesses. So if you think like that, who needs actually home care? All chronically and incurable ill patients need home care. Physical disability, lack of convenience. stay, what to say, they are in the village and there are no vehicles to come to the hospital, very far places. Patient is sick to travel and caregiver, there is no proper caregivers. And especially in bedridden patient, one person cannot handle a bedridden patient. Financial problems, they cannot hire a cab or some ambulance to reach out to the hospital. And at times it happens when the relatives report to us, it is not proper. Usually in palliative care, we sit and talk with the relatives and the patient, ask them the questions, ask them what brings them, what was their problems and what is their problem. But sometimes the proxy, there will be a proxy visit will be there. So when we talk to them, maybe they are not able to answer to us properly. Aging group with health problems. Patient is not bedridden, but aged, cannot reach out to the hospital due to other problems. And of course, long distance. When we talk about the people who are living in a remote village and to reach out to the hospitals, it's very difficult. And of course, the last is terminally ill patient, the patients who have almost reached to death, where they may need some help, some management from the doctors or nurses side. So when we say the need is difficult in coming to the hospital, as I said, physical disability, living in remote place, lack of transport facilities, financial problems, lack of caregivers, no one to look after. And you see this, both the places. Can you imagine getting a car or cab or somewhere here? It's very difficult. The patient is old. Just to bring this patient from here to down, how many people we need? And it's very far off place. Look at this here, not willing to go anywhere. This patient wants to be seen at home because she loves this place. For her, hospital is something very strange place, unfamiliar. No roads and poor resources. See, there are no roads. People are, you see, people are walking. It just like look like a small forest. We have to reach out to the patient's place. And here you see, no proper resources also. You see, they are sitting down. Patient is lying down here. So they also, the volunteers who had gone, they have went for a visit. They also sat with the patient. And why? Most of the time, the hospital stay upsets our normal rhythm of life. Many times it happens, there will be loss of working days, expenditure of for accommodation, food and travel. When we go to even to the government hospital, if we go also, we have to pay for the food. To reach out to the hospital, we have to travel, we have to pay for that also. Disruption of the domestic demands, and of course, disruption of children's education. That is very important. Parents are hospitalized, children education is disrupted. Patient being as the advantage seen is play. The patient has freedom, privacy, and the power of taking decision. Autonomy, we say. See, I am in my own place, so I am independent. I can take any decision. I have the privacy and I have the freedom. My anxiety is very less when I am at home. I'm more confident in talking. And of course, able to complete picture of the family and draw a better care plan. See, once you have a home visit, we will at least come to know who all are there at home. The people at home, who is taking care of the patient, who is giving the medications to the patient, how many people are there, are they in contact regularly with the patient? And of the best place to teach the caregiver. According to their situation, we can empower the family member how to take care of the patient's problems. And of course, home care is the ideal method to identify the rehabilitation needs of the patient and family. So instruction suggestion given from the centralized institution often fail to recount the family background and their interest. For example, just I will tell, physiotherapy is being given in the hospital, But once the patient comes back to home, that equipment they won't have. So we need to teach them simple exercise which they can do at home with the support of their family members. Home care ensures adequate follow-up. See, the treatment that is given in the hospital, especially in a long-term diseases, long-term illnesses, it does not relieve all the symptoms. So we need to have a constant follow-up to know how the patient is getting through his problems, whether the problem, whether his problems are reduced or still it is continuing or it is progressing. These things we need to come to know, because from the hospital they will say everything is gone well, now no need of looking after, you can just look after at home, take back. So these things only in a home care situation we can teach the patient or empower the patient and the family. And home care is the best way to enhance the relationship between patient and the family members, because family members are the one to take care of the patient, take care of the patient. And between patients, family and neighbors, neighbors also will come to know. So one person is there in this house who is in need of the care. At least they can come and communicate with them. And of course, with the other social organization in the society where we are living, they need to know about our problems, and this will enhance the relationship, better relationship. And in the home care, we identify that the caregiver is an important part of the patient care. So not only in the patient's psychosocial issues, but the whole family psychosocial and financial support, we need to throw light on that also, and help caregivers to come into terms with death of the patient and thereafter, where we need to prepare the family members to come into the terms of the death of the patient. That is, the patient is slowly moving to death, and how to overcome that. So only in a home care, many times, only in a home care, we will be able to guide them, tell them how to look after a patient, teach them. See, home care is this cheaper and better option for the care of patients and their families who are having a life-threatening illnesses. And this is very visible impact in the society. So once the society comes to know that home care is being run over there, that maybe there is an organization over, they will also start supporting it. So the human resources in the form of trained volunteers and committed professionals, we need them. So we need trained volunteers and also committed professionals. That is very important. So there are many types of home care, doctor's home care, which is led by the doctor. Doctor will go visit the patient, find out their problems. Nurse-led home care, where the nurse is the leader, she will be the main. So most of the in palliative cares, we have the nurse-led home care. Doctors do visit when there is a problem or when the patient really needs to see a doctor. Otherwise, wants to know. In a nurse-led home care, nurse is the leader and she will have their volunteers and trainees with her. And of course, volunteer-led home care, where the volunteer is only the home care person who will go and visit the patient and to find out their problems. So what are the components of home-based care? As you all have learned in the introduction, that palliative care means it is a physical, psychological, social, and spiritual care. It's not only physical, it's also psychological, social, and spiritual care. Okay. Now you see, sitting with this patient. She's a nurse, the doctor is there, volunteer is there. Even though they are from this state, look at this person, how is listening to the patient. So the basic services, what are the services provided in a palliative care? Assessment of the symptoms. We assess the symptoms. Symptoms means their problems. We assess it. Suppose it is a pain, where the pain is. starting of the pain, when it started, where the pain is, the site of the pain, what the quality of the pain, the intensity of the pain, the impact of the pain on their family life. Psychosocial support, that is effective communication. We come to talk to, we do communicate with the patient to find out their psychological problems, their social and spiritual problems. General hygiene, how to take care of a patient, how to give birth to a patient, how to take care of the patient's eye, ear, nose, everything. And to prevent pressure sore and the management. Wound care, maybe the patients are having a big cancerous wound, how to dress the wound, how to clean the wound. This has been taught in the palliative care. Palliative care, people teach this to the patient's family, and the patient's family are the one, once they go back to their own place, to their home, they are the ones to take care of this wound. They do the dressing. Bowel and bladder care, if the patient is on catheter, how to take care of the catheter, how to take care of the nasogastric feed tube. You must have seen tube put through the nose just for feeding purpose. Then, of course, there are stoma, lymphedema care, and one main important is how ensuring medicine complaints, whether they are taking the medicine in the right time, the right dose. These things we have to ensure. So nowadays, a lot of things is happening, video calls, video conference, uh, that's all, as we say, the relevance of telemedicine. Okay, so because of this, in this COVID, especially in the first wave and all, it was only over to the phone we were talking to the patient and the family. Video calls we have done. Okay, just to know how, what is the problem of the patient, how we can handle in these things. There are a lot of benefits also, because it is both convenient for the healthcare workers and of course for the family also. And most of the patients family, they do have a smartphone, so it is easy to communicate with them. For example, today you have given medication for the pain relief. Okay, so if you have that number, you can just call them and find out how the pain is. Otherwise, the patient is dropped out. You can just find out what happened to the patient. Many times after patient, the death also, family forgets about that. And somewhere, once when they come out, they see our, what to say, the medicine prescription, that time they will remember, oh, I need to go to the palliative care to give, many things are there which I have to give back to them. So, and the telemedicine is very important, and telemedicine is very good also. But there are some issues also. When in emergency, assessing a telemedicine may delay the treatment. And if a patient leaves out an important symptom that might have been noticeable during inpatient care, this can compromise the treatment. And of course, the clinician, patient, families must also ensure that telemedicine program they use in secure and fully compliant with the privacy laws. And I'm not going into detail of that, but as you all know, now all of us, we use WhatsApp, audio, video, everything, just to have a chat to find out what is happening. And things can be also can be done. So when we talk about physical, see, that is the total assessment. What we do, we do total assessment of the symptom. Symptom means, as I said, problem like pain, vomiting, sleeplessness, nausea, this one, what to say, a loss of appetite, these things. And sometimes do we give the the provision of physical aids, if some physical aids are there, whether it has been provided, and of course we do the follow-up. But when we talk about emotional support, because emotional support is an integral part of a total. Now you can see over here, you see this man, just look at his hand. He may be asking, why me? Why I need to lie down like this? What is the problem with me? And here, in a home, when we talk about palliative care, otherwise, when the patients are facing a life-threatening illness, many times this happens, they are in fear. fear of death, fear of what will happen after death, fear of what I will do for my family, anxiety. They are very anxious about many things in the world, anxious about their families, anxious about their children's education. Lots of things are there. And even sometimes they think of committing suicide. The guilt feeling inside, that loneliness they are feeling, and the feelings of being a burden to their family members. And of course, loss of meaning in life. Why only I was born into this world? There is no meaning in my life. This many years, I'm just lying down. What is the use? So they lost meaning of their life. Just have a look here. Just have a look. This is an emotional support. She has gone down. Please look at this lady, and she's just listening to her. And here also, the patient is sitting, and the two nurses, they are sitting with the patient and try to comfort. So these are the, what to say? Just 1 second now. Just have a look here. The touch is so near, just listening to the patient. So this itself will give a good emotional support, listening to the patient about their psychological or emotional problems. The other is the social and rehabilitative care. This I will just show. See, you can see all these patients are on the wheelchair. Past 28, 30, 40, 50 years, they are in the wheelchair. Many of them, especially this man. Yes, he was never out of the house. But once palliative care took care of them, they were brought to a place where where camp was conducted. They started doing many things because they were not having any job. No job, there was no money, no proper food, loss of home, loss of land, no proper education for the children, unable to get the children married off, and they lost their status in the society. And top of that is the stigma. People talking unnecessary things about them. So even they lost their life. They were fed up of their life, thought of even dying. Why to be in this wheelchair? How long we are going to be there like this? Because people are mocking at us, laughing at us. But once they all gathered together, they were taught to make umbrella, many other things, many showpieces and all. And this was their livelihood. Especially this man, so much talented man he was, so much talented. He used to do a lot of crochet work. Whatever he gets in his hand, it changes the shape of that things. He knows a lot of handicrafts, draws well, writes well, and you can see another person I will show. See this person, this fellow. So this all is being taught to the patient, and the family used to help. Otherwise, the students used to help, and this is how they are going to live. Also, they will sell this, and this money goes to them. This they can sit and do at home also. But at times, for a change, we bring all the patients and patients together so that they can have a chat with others. See, when all are in a wheelchair, at least this person will feel like, see, it is not only me, but so many are there like this. They can share their feelings, their emotions. And of course, spiritual care. Spiritual care, when we say, many times it happens, the patients may ask to them, to their own soul, they are asking, God, why this happened to me? Why this happened to me? She may be asking herself, why this happened to me? At this age, what wrong I have done? To my knowledge, I have not done anything. I was good to everything. I was praying, going to the temple, everything I was doing, but still, so many questions start going into their head, into their brain. They start thinking, maybe guilt feelings about the past. So spiritual care is also very important. So here are some photos. You just have a look here. We went for a visit somewhere in the northeast, and just that touch. He just opened the eyes. He looked at me, and again he closed the eye. But we both had something to talk to each other non-verbally. Non-verbally, I came to know his concern. He was tired. He was fed up. Maybe was just praying to God, please take me now. Now you look here, the practical points in response. Patient is so adamant, not cooperative, sitting on the floor. The nurse also went and sat in the floor. So here, why? To establish a therapeutic relationship. And the real presence of another person is a place of security for these people. Many times they are not ready to face the reality, but slowly we have to bring them to the reality where we can establish a good contact with active listening and of course perceive non-verbal aspects of communication. Our eyes, our nose, our face, full, everything, our body talks a lot without opening our mouth. Communication, you just see how she's listening to this patient, just listening to her, seeing, listening with the ears, touch. See, these people all are looking at the patient. He's just touching the patient. And of course, ensure the compliance. We have to give proper instruction to the patient, label the medications properly, check in every visit whether the patient is taking the medicine or not, and if not taking, why they are not taking the medications. What's the problem in taking medication? Which medicines they are taking and which medicines they are not taking, why they are not taking. And of course, we have to consider the financial status also of the patient, because many of the patients, due to financial problems, they won't be able to buy medications, not able to bring them to the hospital, but we have to do a home care or a follow-up there. That is very important. So we have to ensure in a patient's room, I always say, one calendar to see the date, the year, and the day. Clock to see the time. Newspaper and books, if they would like to read. One torch, bottle of water, glass, and a small basin, so that whenever they want to drink water, they can drink water. Otherwise, any time they want to make the oral mouth care, they can do it. And all the medications should be written in bold letters so that it is visible for the patient. Maybe he lost his specs and you'll be searching for that. And if you write in a bold letters, at least the patient who is taking medications independently need to, they should be able to read what is written on the this one, the prescription, the written on the medicinal cover. And as I said, a calling bell or one steel plate or a spoon to bang on it. Why? When they want to call someone, they'll be just calling, sitting and calling Rajan, Rajan, Rajan. When we are not, when we are sick, most of the time sound doesn't come out. Our voice gets reduced. And suppose I want to drink one glass of water, I need to call someone. So if there is a calling bell, they can just press. And if there is no calling bell, the provision is very poor. The patient is very poor. Just go for one steel plate and a spoon. They can bang on it. And of course, a wheelchair, if possible, able to give wheelchair, that will be the best thing to do. At least they can move on. This way. A volunteer, as a volunteer, what people can do. Okay. So a lot of pictures are there. That is why I put it in another. One second. So as a volunteer, you need a require an extension of basic skills. A volunteer needs to have a basic skills. You should know how to care, this one, plan for the care of a patient, work with the patient's families and friends, and of course, need to reassess regularly as changes occur frequently. So a volunteer need to know how to talk to the patient. That's communication. I hope communication is already, that session is complete finished. So you need to know how to communicate with the patient. Basic care of a patient, they need to know what are the basic care. I'm coming to that. How to educate and empower the patient and family to take care of the patient, how to assess the symptoms, and of course, once in a month, wherever you are working, you have to sit with the palliative care people to clarify your doubts. And that is very important. So usually the nursing care for a bed patient, when we talk, their personal hygiene, like care of whole body care, nutrition, exercise, communication, treatment, their treatment, education, these are very important. So I'm just coming to the main, understood? First is the skin care. Skin care means usually we say the bath, how to take care of his skin. And as a volunteer, how you can help. See, taking bath is very important. We all would like to take bath. Because after taking bath, we feel so fresh. We feel better. So in many times it happens, some patients will be put in the wheelchair. We can take them to the bathroom. Okay, to give a bath. For some patient, it is very difficult. We have to give them bath on the bed itself. So the nurses do teach the family member how to give a bathroom bath or how to give a bath on the bed. Because that improves even the quality of life of a patient. Keeping oneself clean, neat and tidy, that is very, very important. Because this prevents many infections, prevent even the breakdown of the skin. And of course, we can even teach the family member how to take care of a wound if a wound is there. So usual things, as a volunteer, you can educate the family member, tell them whenever you are giving care to the patient, especially giving a bath, bed bath or in a bathroom, whatever it is, please don't wear any jewelries, a ring and rest of the things, because that can hurt the patient and it can cause an injury. How to make a bed. Bed making is very important in palliative care because most of our patients will be bedridden. So, and there will be only one caregiver. They cannot just, one person cannot just lift a patient and make a bed. It's very difficult. So here what happens is we can teach the family member how to make a bed with the patient, how we can change the bed sheets. After bath, why to apply moisturizing cream to keep the skin intact, encouraging the patient to take a lot of fluid so that the skin is moist, doesn't become dry. So the important thing to think of bath is, when we talk about bath, by bath we can remove all the dirt in the body. It helps in a circulation because we'll be rubbing. So it helps in circulation of our blood. It prevents pressure sores. After taking a bath, we are comfortable. We can have a good sleep because it helps us to sleep. And even you see, once you have traveled and all, and you're coming home, after you take bath, you feel relieved of that fatigue, right? You will be very tired when you come home, but soon after taking bath, we'll be fresh. So that is very important. And even after taking this bath, also helps in regulating our body temperature. It provides active and passive exercise, both. And the main important thing is health education and empowering the patient and the family. And this helps to establish a good rapport with the patient and the family. So one or two things what you can teach the family member is, whenever they apply the soap, ask them to take the soap in their palm, not to apply directly the soap on the body. Instead of that, just apply it on the palm and then apply it on the body, and thorough washing of the body to remove all the soap complete, because soap dries the skin more. So to prevent too much of dryness, we have to apply minimal soap and wash it thoroughly. Usually, to say it is a joke, but usually this happens. Some people, they apply a lot of soap, and when they we pass through, we can say whether they have used Medimix soap or Chantriga or Hammam and all. That smell will come. So why to apply so much of soap? That should be avoided. And of course, tell the family member not to give bath soon after a meal, because it will have problem with the digestion. We have to remove the complete dirt from their body. And if possible, as far as possible, if the patient can be put on a wheelchair or a plastic chair and taken to the bathroom, that will be the best thing to do. So bath prevents pressure ulcer, because when a patient lie down for a long time on the bed, flat position, they develop skin problems. We tell it that as pressure ulcer and injury due to prolonged lying down position. See, we say this is the first stage where the skin is intact, but you see it is red in color, the skin. And if in this stage, we need to relieve the pressure of the patient, relieve that pressure from one side, so that we can prevent the breakdown of the skin. Now the second one you see, this one, already there is a skin breakdown. This is the second stage. There is a skin breakdown. You can see it inside. Here also we need to relieve the pressure. Now the third one you see, a little more deep it is. And the next one you see, very deep. So usually what we say is, whenever a patient, as a volunteer, you can teach that the skincare is very important. Mattress, this can be used to relieve the pressure. But remember one thing, even if they are in the water bed or the air mattress, still the position has to be changed. If they are not in the bed every 2 hours, but if they are on the bed like air mattress or a water bed, At least 3 to 4 hours they have to change. That is very important. And whenever we are making, there should not be creases on the bed. After giving feed to the patient, we have to clean the bed, because even one small crumb of rice also will cause pressure ulcer. So these things we have to teach the family member. Pressure ulcer. It is very simple thing. We have to just care with a normal saline and put a simple manner. But the best thing is prevention is very important. So we have to keep the sheets dry and wrinkle free. Keep the patient moving. Mobility should be the turn the position of the patient. Give a good back care. Give good bath. Inspection of their back to see if there is any redness has come. If they have developed some redness on their body, keeping the skin moist soon after bath, just apply some moisturizing cream. If nothing is available for poor patient, just have a put little bit of oil also. That also will be better. So that's why I said, in a lying down patient, every 2 hours we have to change their position, and in a sitting position, every 30 minutes we have to change their position. And suppose you come across a patient who is having redness, you found that skin is reddened, immediately report to the palliative care. So because there are a lot of devices which can be used to relieve the pressure. Another thing was usually I say is always place the patient's cot at the window side so that the patient can hold to the rails of the window and they can change the position. No need to wait for someone. So, and moreover that, once you put on the window side, the patient is able to look outside. He can enjoy the greenery. He can enjoy the, what to say, the breeze, the wind. He can see the people moving around. And many other things are there. Now I'm coming to that. See, these are the overhead bars. These are now available in the market. Otherwise, some people even make it and they fix it on this. So the patient want to sit, he can just hold on to this and he can sit. It helps him to sit. No need of waiting for the bystander or the family member to make him to sit. He can just hold on to that and he can sit. He can change his position. Now you see, in the hospitals, you must have seen these rails, bed rails. If you could get like this bed also, it is okay. At least they can hold on to and they can change. These beds can be put in upright position also, just with the help of this key. If possible, they can get the beds like this. Otherwise, what they have to do is, it's a flat bed. They can use 2-3 pillows to raise in the head end. Now next one, you see how the patient is sitting, 2-3 pillows at the back. They are put near the window, so they are looking out. See, she's out of the bed, but she's still sitting in the bed. She's looking out, enjoying the greenery, enjoying the outside breeze. See, this bed doesn't have anything, but once it is put near the window, one side there is a window, this side we can help out with something we can tie on this, so the patient will be able to move. So many types of bed are there. You see, these are many types of bed. This is the backrest. See, I showed you this position. You see, this patient, to make them to sit like this, if the bed is a flat bed, many times flat bed comes means we can use these things. So they can just lie down on that. In upright position, they can sit. This is an air mattress and this is a water bed. Air mattress, but the problem is that it needs current, electricity. But of course, water bed doesn't need electricity and all. Poor patients, how they are going to afford the 24 hours, this should be on. So give always a side lying position. That is very important. So whenever the patient lie down, keep a pillow in between. You see, this is the best position. to prevent a skin injury. A pillow over here, a pillow over here. The common sites where we get pressure ulcer is, you see, the elbow, inside the knees, and these are the places, because if they lie down on a supine position, we say this, we call this as a supine position. These are the places where we'll get pressure ulcers, which I have shown that wound. This is another place. See, back of the buttocks, on the heels, on the side of the feet. So now, special attention where we have to give. So we are coming to that. First is the eyes. See here, the fold of the eyes, accumulation of dirt will be there. So we need to give a thorough wash of the face and clean the eyes from inner to outer, not from here to here, from inside to outside. Nose. This is the place where the dirt will get accumulated, this here and inside. So again, cleaning of the nose in these folds, that is very important. Cleaning of the ear. Remember one thing, don't put anything inside the ear, especially pin and all. No. If they are having wax and all, you can just talk to the doctor. Nowadays, because in the market in the sense, you can get it from the pharmacy itself. This one, what to say? Medicine is there. Medicine in the sense, this one, like a drops, it is there, which can be instilled inside the ear, and the wax will get loosened and it can be removed easily. So especially this part of the ear, this part, even after taking bath, many times here the soap will get accumulated, the dirt will get accumulated. So we need to pour here nicely water and clean it. And the other site is over here. You see this fold and inside. When you travel, just look at your left side and right side of the passengers who are traveling with you. Some days you can see so much of dirt in the ear, black color. You see here? So cleaning of these places is very important in a bedridden patient also. Now hands and feet should be always immersed in a basin of water. It gives a good feeling. Before taking food, we usually wash our hands, right? After taking food also, we wash our hands. So that is very important. And moreover, what happens when we immerse our hand in water, hand and of course the feet, our nails become soft and it is easily we can cut it. We can prevent cracking of the heels also. You can tell the family member if the patient's heel is there is crack, ask them to dip in lukewarm water, little bit warm water to dip for 10 to 15 minutes. Then clean with a soft moisturizing cream. That will keep the this one heel soft. You see, in between the digits, in between, here is the where we get fungal infections. So these are the places. I say after taking bath also, once you have finished taking bath, even for our own purpose, I'm saying after taking bath, take some water and clean the feet, because when you pour water, all the dirt accumulates in between these digits. So pour nicely water and clean here. Worst place, this one, umbilicus. All the dirt goes and accumulates here. So apply little oil over here and clean it. In between the buttocks. These are all hidden places which we forget to clean. Under the arms. Very important, very dirty place. The fold of our elbow. See, fatty people, they will have, you see the fold. So this fold, inside this fold will be, there will be dirt accumulated. So we need to extend our head like this, neck, and clean it. And same here also, you see folds. Children, babies who are very plumpy babies, what we say, Usually the mothers, when they give the bath, they do it like this, and then they clean. And same thing at the back also, they just little bend and they clean it. That is very important. Groins. This is another place where special attention should be, where dirt accumulates. You see this one, this abdomen, under the abdomen, it's already, what to say, uh, mm, hanging on the front. Okay, so we need to lift it. We need to lift it and then clean it. Under the breast, you see this folds under the breast. Back of our knee joint, under the breast. These are the places where we get this one, what to say, the dirt accumulates. Care of hair. See, at least the care in bedridden patients, especially when you go for a home care, in the home-based care, you can teach them how to give head bath. Encourage the family member that at least twice or thrice in a week, head bath should be given to prevent dirt and prevent pediculosis also. That is very, very important. See, nurses do teach how to give a head bath. This as a volunteer, you also can learn it. Oral care, mouth care is very important. We do brush daily, right? In the morning, after each food, we used to rinse our mouth. Night before going, also we brush our mouth. And why not for the patients? We need to give the patients all the same thing. Provide water, one small basin, everything at their bedside. So whenever they eat, after eating food, they may feel to wash their mouth. Otherwise, after a small sleep in the nap in the afternoon, they would like to clean their mouth. So keep everything on their bedside. Patients who are able to do self, give them the brush, toothpaste, everything, but be at their bedside. That is very important. So the patients, when we talk about the patients who can do it, they will be in a sitting position, provide all the things for them, let them clean, brush, and after that you can remove the other things. You see, you see this photo? She just helping only. She can brush, no need of any other support, but we have to provide all the things. But when a patient is unconscious, if any time you have met a person, a family where the patient is unconscious, always the patient should be put on a side-lying position to give a mouth care, not on a straight position. If they put on a straight position, the water will go inside and the patient will die. So these things usually the nurses teach the family members. And as a volunteer, you people can learn from them how they are giving. You can help the patient's families. Maybe someone is there at your home also where you can help them. You see, you put them on a sideline position, then we do it. See, sideline position. Sorry. Now, nasogastric feeding. Volunteers can learn about the care from nurses and educate the family how to give a feed. Always to give a feed in a sitting position, not on a lying down position. And through this feed, through this tube, we give only liquid food. Listen, liquid diet. Many things can be given as a liquid diet. It should be given every 2 hours. That all nurses will teach 2 hours, 200 ml. But what can be made? As a volunteer, what you can teach them is one thing, always feed the patient. Before feeding, make the patient to sit. Patient is conscious or unconscious, that doesn't matter. And see, this should be the position. After each feed, mouth care is very important. It is not that family will say, oh, he's not taking anything by mouth. That's why we have to give. No, it's very important. Give a mouth care. See, now this many time, this first time I was talking to you people, right? See, my mouth has already dried. Same thing can happen with the patient. And what we can give? Clear tea, Weak black coffee we can give. Clear soups we can get lot of vegetables, boil the vegetables, mash it, otherwise put it in the grinder and just take out of that soup or that juice, and that can be given to the meat, chicken, cereals and pulses also. You can cook and then you can grind it, take out that juice, add water, give it. Strained fruit juices, you see, strained fruit juices you can give. Fresh fruit juices, that is important. Milk and egg flips, thin custard, the water, rice now after we remove the rice, that rice water can be given. Add salt if there is no restriction. See, whatever you make at home, you can give instead of buying this protein powder and all from outside. Encourage the patient's family to cook at home and whatever they are cooking to make it in a soup form and give it. Bowel, that is very important. We have to encourage the family, tell them that the patient should be taken to the toilet, otherwise given a bedpan or a commode daily so that there is no problem with the bowel movement. Daily is passing motion. See, this is the best position. This is the best position, I say, for a life-threatening patients. I mean, the patients, it's very difficult to sit them in the squatting position. That is in the Indian toilet. Just provide them with a Western toilet, otherwise a bedside commode. I will show. See, this is a old chair, made a hole in that. And you see, we have put that pot. See, this is a bedside commode. You can keep this one at the patient's bedside. Whenever the patient wants to use the these are all available in the market. This can be kept on the top of a this one Indian toilet. The patient can sit over here. Next is a bladder care. Now, as a volunteer, what you can do for a bladder care? Just tell them, encourage the family member to tell them to give to the patient at least 2.5 to 3 liters of liquid. Liquid in the sense, liquid diet, what we say, liquid. Maybe it is tea, coffee, juice, water, whatever it is, to prevent urinary infection. Always to carry, I will show some photos. You see, tell them whenever a patient is on lying bed, if you enter a house for a home visit, just look where this bag is being kept. See this bag. It should be always kept on one side below the patient's level. And if the patient is on standing position, it should be always on the below the this one waist level. It should be always below. This one is called a leg bag. Patient need not hold it and walk. It can be tied to the leg. This can be given to the male patient, urinal. But said you give whenever they want to pass urine, they will pass. So these are the catheter. We usually say these are the catheter, urobag. Okay. And of course, exercise is very important. Give the patients regular exercise. So in physiotherapy, maybe some physiotherapists has taught them the exercise which you have noticed. You were there and you also notice how they are giving. So you can encourage them to do the exercise. Encouraging is very important. Encourage them to do the exercise. And as a volunteer, you can also learn what exercise are suitable for that patient. And you can encourage them to do that exercise. Simple things, hold a ball in the hand, they can just press it. This is one type of exercise. See, this is an exercise. Folding, opening, this is type of exercise. And we have the chapati belan and a chapati roller. That's also a very important thing. You can keep under your feet and you can just do like this. That is another exercise. So it helps for them to prevent joint stiffness. Joint stiffness you can prevent. We can move all the joints if exercise is good. Patient also feel better. because always lying down, they feel very bad about it. So these things has to be improved. And what is needed is very important is patients need our love and companionship. Someone to listen to them without being judgmental, and just our human touch. They want to just sit with them, listen to their story without showing our attitude. Just listen. Maybe sad or happiness or whatever that is. Everything will come out from the patient. But just listen to them. God has given you 2 ears and one mouth. Usually we forget, we think we have two mouth and 1 ear. So forget about that. Think we have 2 ears to hear and one mouth to talk. Encourage the patient to talk to you. If they just say, I cannot sleep, ask them why they cannot sleep. What is bothering them? If they say, I don't feel this one hungry, ask them why you are not feeling hungry. Is there no sufficient food at home? Or you want something else to eat? Or you are worried about something that you don't want food, that you are refusing it. And of course, it is a teamwork. The team includes volunteers, social workers, nurses, doctors, physiotherapists. We need all these people, and all these people can be trained in palliative care, and they are our support system. For a doctor and a nurse, they need volunteers. Sometimes to relieve often and to comfort always. And remember one thing, it is not how much we give, it is how much love we put into giving. Now you may ask how they know how much love we have put. Yeah, you will know. A touch of love, a touch. There are different types of touch. You all people also know about it. That affectionate touch. We know it. When the touch is there, we come to know about it. And same thing when we give, if we have put love in that, it is very different. We say now when you make some curry at home, some people say it's very tasty because my wife has put her love also in that. So that is why it is very tasty. Okay, same thing. Put your love in your care and everything will be good. Thank you. So Rajlakshmi, here I end with my presentations. So it is open to any questions. People want to know something, even if you can share your experience also, you can do it. So
Thank you,
we
Sister
can.
Stella. Shanti, ma'am.
One second.
Yeah. Is there any questions, anybody, audience? You can put in your chat. You can raise your hand or you can just unmute and ask the question. It has been a wonderful session, Lieutenant Stella. So everyone, I'm sure they understood and very clear, nothing to ask about, there's no doubt, and you made it so clear, and the need and how it should be done, and each and every aspect. I'm sure that everybody was living through it, like imagining themselves into their own home-based care. So
They need to just go. So they will come to know more about it. They can just visit the patients. They'll come to know what is being done, how they are doing it, and after that they can have a visit. It's not that always they always to go with the nurses and doctors. No, some home care they can do with the doctors and nurses, and after that they can have their own independent home care. They can visit the patient, talk to the patient, spend a little time, and find out what are their problems and inform the palliative care. And that is a great support for the palliative care healthcare providers.
Yeah, it's true, especially during this time of pandemic and people are, restricted to their homes and like avoiding visits. So it is kind of, they have to do it carefully also. Very diligently, they have to plan and do it. And if they can come up or get information over the phone or whatever it is, so that might be helpful and useful also when if they can communicate to their respective palliative care agencies or institutions, whichever is closer to them and available to them. So looks like nobody's given any questions in the chat.
May I just ask?
Yeah, please.
Elaine, do you think it's possible for volunteers to start working in their areas, even if there is no formal palliative care service there, but they have seen a need and they want to help?
See, if there is no palliative care around them, at least they can talk to the patient, give psychosocial support. See, leave the physical problems. They can just ask them about their physical problems. But what a patient and a family needs is someone they want to listen to them, listen to their problems, listen to their story. If suppose a patient, I will just give an example. We had one doctor over here who had come to our palliative care, and she only what she want was she told me that my mother is aged lady. Okay, we all go for work, and it happened many times. She wants to talk to us, but we cannot spare a lot of time for that. And they never, in the sense that they never went into their brain that we had to spend little time with them also. Okay, so we say in other words, we say she was a little bit cranky like. Okay, this mother was always giving some other problem she was saying, but actually there was not much problem. What the problem was, she actually needed someone to talk to her, listen to her. So our palliative care, actually they went over there, they spent little time with her, and it became a routine once in a week or 15 days. But that lady was very happy about it. She had a lot of things to share with them. It was just like ICU told her just to tell stories. And see, maybe as a volunteer, you can help them, put them in a wheelchair, just take outside of their house. They can just look around. And your presence may help the family member to understand it's not only 3 times eating and giving everything inside the house. It is that you have to sit and listen to them. Maybe you are having grandchildren. Please ask your grandchildren to spend little time with them. That is very important. So you need to put that effort to make the family member understand actually what these people need. Maybe they will get their physical things are managed in the hospital or everything, but nobody attends to their psychosocial problems, their spiritual problems. And that part is very important where a volunteer can do it.
Thank you.
Welcome.
Yeah, very true, ma'am. That's what most people are like feeling now these days, like with the nuclear families and elders are like isolated and they are lacking company and somebody to share to and to communicate.
Yeah. Even in the COVID time also this has happened. This is the COVID time. Many people have called me, even though they are negative, but some put in quarantine and all. They want to just what to say, vent out all their problems. Okay. So I remember one doctor talked to me for more than 1.5 hours over the phone because his father was positive and he was so tensed. There was no much problem, but he was tensed. So we were just talking. Something we were talking. At the end of this one, he was telling, oh my God, all my tension has been relieved.
Great.
So that is very important. Elena, can I ask you, you are from which place?
I'm in the UK. I used to be an oncologist, a consultant oncologist.
Oh.
But I'm working with a group of people who are keen to start up palliative care around the world, Africa, Pakistan and Middle East, in areas where as yet there isn't any help.
Okay.
And so we're very grateful to be able to look into your program.
Thank you.
Lieutenant Alice, would you like to share some of your army experiences, like now that we have time?
Yeah,
Like
sure.
anything
Army
interesting.
Recently, I had written an article. Actually, I've shared something in our newsletter also, and in
Okay.
the He Space also they have put that article. Actually, they were asking, see, in army and my civil life is so different. In army, usually the patient, they don't have any bystanders. They are left alone in the hospital, and we are the only one taking care of a patient. Okay, patient
Yeah.
and doctors, and we are the only one people. So many times I have come across when we talk to the patients, now, a lot of psychological problems they face. One thing, as in army, it is very strict. They have to follow discipline. That everything has to go. That is on one side. But the other side, even though they are uh, built up like that, but when they fall sick, that is where they start thinking a lot of things, because family is not near. What will happen to me? What will happen to my promotion? What will happen to this? What will happen to that? Yes. I remember one thing which was very saddened to me. I still remember, keep that in my mind. When I was working in Nagpur, that is in Maharashtra, in a hospital, that was really touching for me. There was one patient admitted as in ICU, which was a very small extended hospital for us, a small ICU we had. And we had a high fever, and his diagnosis was myeloid leukemia. Okay. And of course, his condition was deteriorating. He was in the, and the sad part of what was the story was, before that I will tell, daily evening his wife used to come and meet her. Okay. Whenever she comes and goes, this fellow gets disturbed. He gets distressed. Okay. And one day I noticed, because we used to look at, because at 4 to 6, we never used to interfere in any things, because that's the time for them to talk with their family. Okay. So I noticed one day, as soon as she leaves, when she becomes distressed, and one day I noticed even tears were coming out, okay, from his eyes. So I felt something is wrong over there. So, and usually I was very, I should not say I was talkative, but I used to make the people talk to me. Okay. So I just went near to him and I just asked him, what happened to you? Well, why these tears? But and I have noticed in so many days, I'm noticing that whenever your wife comes and goes, you get distressed. I can see it on his body language. Then you know what he told me? He said, ma'am, I got married. When I got married, also the day I was running high fever. Okay. The day of my marriage, by the evening, I was hospitalized. First, they thought he's having a typhoid fever. Okay. By the investigation, by the 10th day of all the investigation, he was diagnosed with leukemia. Okay. And that also, nothing can be done ahead. Okay. And he says that, and army had a lot of what is a paperwork to do. Once you get married, you have to do part 1, part 2, and everything. That is publishing that I have got married to so and so person, and all these things has to happen. Okay. As soon as this girl and her family came to know that he is suffering and is into his end days, whenever she comes, she used to ask him, it's him, how much I will get, percentage of amount, how much I will get. Yeah? And he has his mother and his brother only. He lost his father when he was in a childhood. Okay. And he was saying 75% he has written for his mother, and 25% what was in his brother's name. Okay, whatever it is. But he never got a time to change anything by the time he was hospitalized also. That is another thing. And the way he's telling, ma'am, even not in one night I stayed with her. Got married, I was in the hospital. And at least a little bit concern she should have when she comes and talks to me. She never used to ask how I am, what I am suffering from, nothing. She just wants to know only that if you die, how much I will get. And at the other side, the in-laws, my God, the in-laws were very bad than her, I should say. She was better, I was saying. The way the father-in-law was speaking, he was telling, After you die, do you think that my what to say, my a daughter has to live like this? How can you give everything to your mother? I will fight for this. And these were the things he was saying. And even he said, he threatened that I will hurt your mother and your brother if I don't get anything. And this was disturbing him, and he was not able to speak out. Okay. So when I came to know this, immediately I reported to my officer, I mean the doctor, medical specialist. I said, sir, something is going like this. What we can do for that? So immediately we had to the higher authorities. They all came, they sat, they talked to him, and finally made it a point that 1% should go to her so that at least his parents will be living peacefully after he leaves. That was very important. I have come across so many patients like this who actually wanted to open up, but there is no place for that. They are suffering. They wanted to talk to someone. They want to open and tell that something is wrong with them. They feel some psychological problems. But to whom they will talk? No bystanders. And as one nurse, to whom I will talk? So many patients. And our timing also, in army it is very strict. Right time only we can give the medication. The timing is there. Everything we have to do. So I have felt not only in army. So this time when I given the article also, I said palliative care is very important in Indian army. Very, not an army, I mean in the defense. Palliative care should be the where we can sit and listen to the to the what to say, the personals, army personals about their, see, sometimes someone has lost their parents, otherwise brother, sister, and once they are come back, they need someone to talk about that. At least if there is a what to say, one social worker or a psychologist, someone is there, they can just vent their feelings. Yeah, they must have spoken to their friends, that is there, but some support system they need. Same thing happens when I joined civil also. Many times I have come across where the patient keeps everything in the mind and doesn't want to share it with their family, because he feels if I share with my families, they are also burdened with that. They are also affected by these things. So they want a third person to talk to them. And who is that third person? Maybe the people in the hospital, we, or someone who can just spend little time to with them, even 5 or 10 minutes, that will be very important for them. That somebody has listened to me, they have just given a smile, they have touched me. So that is very important.
Thank you so much for sharing. I mean, it's a touching story. And there's Waqas was raised his hand. Do you have anything to ask? Please ask. Unmute and ask.
Yes, this was very informative, and this was very learning. And I want to share an experience which I had last year in Pakistan. He was my uncle, and he was suffering from COVID. And the problem was and what we experienced here was in COVID, here we have home health care, patient care services as a business. And the people who were running the business, they raised the price of visiting the patients at home and to provide them IV medications like remdesivir and all that injections. So my uncle, he was not able to afford that. He called me and he said, I'm a nurse. And he said that if I can, you can give me a favor, that I need IV medications. The doctor has prescribed me. And I said, okay, uncle, I will come. You don't you worry. And I went to him, and he was so very hopeless. He said, I called 2 or 3 home health care services, and he said that no one was reducing the charges of one visit. It was very high at that time. So we spent the time together. The presentation included the the religious aspect as well. So we prayed together. I prayed for him, and he got some hope. Uh, by the grace of God, we completed his medication, IV medication. He's fine now, but there is the thing that we need to have volunteers. We need to have people who can feel the pain, who can feel that people cannot afford expensive. Even there are people that can not afford low rate of visiting home visiting charges. Yes, there is a need. I agree. And the presentation was very helpful, and we are sharing all this information that we need volunteers. We need that spirit to care. We need that spirit to love each other and serve. Thank you very much.
Welcome. Marcos, you are from which place? Hello?
I'm from Pakistan.
So you are from Pakistan. And being a nurse, I think you have to take the first step. Why don't you
Yes.
start? Huh?
Yes,
See,
yes.
people, I say one thing. People always wait for a person who will throw the first stone. Okay, after that, people will start throwing the stone. But I think you can throw the first stone. Keep the first step.
Yes,
You
yes.
see, so many are going to be your backbone. They will start supporting you, and that is the first step you can do. Bring a change.
Yes, I have started that. I have served too many people last year.
Okay, okay. That's
Yes,
good.
and I'm carrying it. How long I can carry it?
May I say something? I cannot
Yeah.
raise my hand digitally. May I?
Yeah, no problem. Yeah, come on, please.
Okay, if you can. The viewers must have seen me in a clergy collar in the past 3 days.
Yeah.
And that shows that I'm a pastor, but I have a medical background. And I have been working, had worked for almost 20 years in the hospital. I practiced medicine. My more interest was in the field of nursing, making some researches, teach them new methods of taking good care of patients. What has been said, with a due apology, what my ears could not hear in the previous days, we do talk about head to the toe care. Excellent. But sometimes patients get constipated, these kinds of bedridden patients. And if attention is not paid to them, to this problem, they get impacts too that has to be removed manually. And it is terrible for the patients, painful too. But beside all what has been said, excellent, I said again, but this attention has to be paid to the patients. Give some laxative because they're not mobile, they're not moving, they are in the bed, and very easily they get constipated. And I shared experience added to what I have been said about the constipation. I mean, of course, some laxative as prescribed by the doctor must be given so the patient don't get constipated. An experience, I was working in a hospital and nursing advisor, and I gave a task to somebody to give a complete bed bath to a patient who was suffering from hepatic coma, totally not knowing what is happening right or left. So that male nurse gave bath to the patient with the help of the family male person who was staying with him. And after an hour, a bit more, he asked me to come and see. And I was literally very happy to see the patient on the bed. He gave him complete bath, even he combed his hair, put a powder on the neck. And he said, I cleaned his armpit and groins and every part of the body wherever he could touch. And complete bath, and well dressed and covered with the sheets and etc. And he asked me, sir, you check any part. I have washed him very well. I said, no, Salam. It was in the Middle East years back. And his name was Abu Atif. I said, you did an excellent job. He insisted me to check something. Okay, if you insist me to do something, I will check his mouth. He said, oh, I did everything, but forgot to give him a mouth care. And mouth care is that important. I heard one patient who had open heart surgery, cabbage, and he, while in the ICU, protocol patient, stayed 3 days there, and then he was shifted to the ward where I was responsible, and the floors, floors, I mean, different wards up and down. He said, Mr. John, I did not suffer much from my open heart surgery, but I'm suffering from my mouth ulcers, which I get being not given anything by mouth. I kept NPO, we call it, nothing but oral. So I gave him some methods to heal his mouth as early as possible. It was successful. But then from that patient, his statement that he suffered more from the mouth ulcers rather than his open heart surgery, I thought the mouth care is very important. Another experience I ever remember. One patient, an old lady, an old retired nursing superintendent of the hospital, age, I guess, 80 or 70, 75, brought to the same hospital where he has worked and supervised the nursing care for more than 40 years. And of course, she came with the gastroenteritis. Doctors kept him NPO, put some IV fluid for a couple of days, and nobody did mouth care. And she developed mouth ulcer. I used to visit her once a day. She was my relative, but not interfering with the nursing staff performance or with the doctor. So she told me that I have a mouth ulcer. And I said, oh, this is the medicine you have kept at the bedside. This is good for mouth ulcers. Or with oral. And I went again next day, and the second day and the third day, she said, I'm not feeling better at all. I need to find out why she's not getting better with this medicine, which is excellent medicine, Nilstat or Nystatin. She said, I was given once on the first day when it was prescribed, and the nurse brought it to me, and nobody gave it to me afterwards. I went to the nurse's station, asked for her file, looked at that file. It has been signed 3 times a day by the nurse in charge of that ward, but not given. Why it was not given? Because the first dose the nurse gave it to the patient was with a dropper, which is provided with the packing, and she put directly into the mouth, and it went to the throat and got boots up because it went to the trachea rather than staying in the mouth for taking care of the ulcers. And it went to the trachea. She had boots of cough, and rather than telling to the doctor, nurses were hesitant to give that medicine again, and she suffered. These are the weaknesses sometimes happens in the hospital. And I was when I was working years back, and I was paying attention to all these things for all the patients in the hospital. So this is my experience. You must have not been knowing what I'm doing, but I have a pastor, but I have a heart for sick patients. Still, if I get a chance to work with the sick patient, beside my ministerial services in the church and congregations, I would love to do that. Thank you for listening to me.
Thank you. Thank you. See, as you said, it's very right. But in palliative care, our main focus is on patients' constipation only, because whenever a patient is given some medication, in our patients who are put in analgesics, we see that the patient is taking some laxative.
Yep.
That is very important in palliative care. So our doctors and nurses, they know very well that the patient has to be put on some laxative, especially on a bedridden patient and the patients who are taking other opioids and all. So we focus on that.
Very good. Very good. Very good.
Thank you, Reverend John, for sharing such an interesting incidences. It's good. So people will think again about oral care. Like you said, usually like it's neglected. We always think of other cares and bodily head to foot, and oral sometimes we just take it for granted or forget it. Anyway, thank you so much for sharing. It's great.
My pleasure.
And I think it's time, Raji, to wind up. Thank you all for being active participants, and thank you, Lieutenant Alice, and all the participants, Elaine and Wakaf. Okay, it's only thumbs up. And Reverend John and everybody. So see you all, only one more day left. And tomorrow we'll meet you all. Be safe, be strong. And I hope you'll be answering your feedback form. Take care, all of you. Stay safe. Bye.
So once again, thank you all to the participants. And of course, thank you, Pallium India also. Okay, so giving me this opportunity to talk. And of course, it was a very interactive session. I thank for that. Because it should be interactive session. We also feel good when we talk to others. Okay, thank you.
Yeah,
Thank you
everybody.
all.
Yeah, thank you, Lieutenant. It was very,
Thank you.
everybody felt comfortable. You made everybody feel comfortable. So it was easier that way. Thank you so much. And it was very
Bye.
interesting. Thank you. Take care. Bye.
Bye. Bye. Bye. Bye.